News, and for those of you watching on onespotmedia.com, thanks for joining us. Even as vaccine hesitancy remains a concern, Jamaica is to begin administering booster COVID-19 immunization shots. Health Minister Dr. Christopher Tufton, who made the disclosure in an interview with TVJ News today, says only persons who are immunocompromised will be offered the third dose. Shamela Pullen has our report.
Countries around the world have already begun administering COVID-19 booster shots. Since then, local public health specialists have been wondering when Jamaica would follow suit. On Saturday, Health Minister Dr. Christopher Tufton said, based on scientific data and after several consultations with the experts, the country is now in a position to administer a third shot.
We have taken a decision to allow for booster shots involving all three vaccines, Johnson & Johnson, Pfizer, and AstraZeneca, for persons who have compromised immune systems. So, persons who are HIV positive, persons who are cancer patients, hypertension, persons whose system is compromised, and therefore they are vulnerable.
In the coming days, persons who fall in this category can begin making their appointment. We caught up with the minister at the National Arena, which was one of several vaccine sites. He said the country has reached 23% of the World Health Organization's 40% target of persons fully vaccinated.
At this stage, the house-to-house represents, to my mind, a very important part of the program, as well as the mobile units, the mobile setup, community-based interventions. Largely because we're getting to a point now where we're taking up all the enthusiastic people. The others are people who are fearful, who are maybe immobile, or who have questions. And then, of course, the hesitancy. So 440,000 Jamaicans, almost 1 million jabs administered, is a good sign.
Over 85,000 Jamaicans are due their second dose of the Pfizer vaccine. Since Monday, approximately 10,000 have been given their second dose. The Southeast Regional Health Authority says it has a target of 30,000, which it is hoping to achieve within the coming weeks.
We have uploaded a total of, 3,500, about 4,000 doses were uploaded for Kingston and St. Andrew today in terms of available appointment slots. For St. Catherine, we would have uploaded 2,000 slots. For St. Thomas, we uploaded 500 slots. So persons should be able to get their second dose vaccine today, as long as they turn up. Of course, we're starting with the appointments. Appointments will get priority. If there are walk-ins, we will try to facilitate the walk-ins.
Regional Director for the Southeast Regional Health Authority, Errol Green, says the demand for the various brands continue to fluctuate.
There was a time when the Johnson & Johnson was very popular. We realized that demand over the past few weeks have not been as popular as before. Persons are now asking for the AstraZeneca. And so therefore, we have enough vaccines to accommodate everybody. The only issue is that the Pfizer, we're going to be concentrated on the children, the school children, and the persons who are due the second doses.
Shamela Pullen, TVJ News.